Good afternoon, everyone, and thank you for participating in today's webinar about Medicare's new ID cards. So let's get started. Okay, so today's webinar is going to be in essentially 4 parts: an introduction, implementation, timing, and then talk about what eRAD is doing to prepare its risk system and other software for the new Medicare ID cards. And then after the 4 components, we'll open it up for a Q&A session that Brooke will moderate. So introduction. So currently, Medicare beneficiaries are identified according to their health insurance claim number. And again, it's a Medicare beneficiary's identification number, and it's used for processing claims, determining eligibility across the board. And that includes Medicare providers, state, special entities like Railroad Retirement Board, etc. Now, the HICN is currently based on the beneficiary's Social Security number, SSN. And over time, that's proven to be problematic for both issues of fraud and abuse within the Medicare program and also issues related to identity theft. So enter MACRA, the Medicare Access and Chip Reauthorization Act, and this was passed in 2015. And included in MACRA was a provision that requires CMS to remove the Social Security numbers from all Medicare cards. And again, this was done in an effort to mitigate the risk of medical identity theft. So replacing the HICN is the new Medicare Beneficiary Identifier, or MBI. MBI serves as a more secure replacement for the HICN, and per MACRA, CMS is required to mail new cards, each with a unique MBI, by April 2019. So why is Medicare doing this? What are the goals of this initiative? The goal is to decrease the Medicare beneficiary vulnerability to identity theft, while also minimizing the burden for beneficiaries and providers, minimizing the disruption to Medicare operations, managing complex changes across more than 75 systems, and conducting extensive outreach and education to all affected stakeholders. So, implementation. So where are we in this process? So throughout the beginning of this year, CMS has been generating MBIs of approximately 150 million initially. And that includes 60 MBIs for the current 60 million active Medicare beneficiaries, and an additional 90 million MBIs for those beneficiaries that are either deceased or inactive. Now, the MBI will have some very distinct characteristics. First of all, it has the same number of characters as the current HICN. That's 11. But as we'll see shortly, the MBI is visibly distinguishable from the HICN. You can't mistake the two numbers. The MBI will also contain uppercase alphabetic and numeric characters throughout the 11-character identifier. Again, it's hard to make a mistake between the two ID numbers. The MBI will also occupy the same field as the HICN on transactions. The MBI will be unique to each beneficiary, such as a husband and wife will have their own MBIs. The MBI will be easy to read and limit the possibilities of letters being interpreted as numbers. And this is done using uppercase characters, uppercase alphabetic characters, and exclude letters such as S, L, O, I, B, and Z that could be mistaken as numbers. Now, the MBI will not contain any embedded intelligence or special characters. Or in other words, the MBI can't be reverse engineered to tell you something about the beneficiary. They're uniquely assigned and can't be broken down into component parts. And then lastly, the MBI will not contain any inappropriate combinations of numbers or strings that may be offensive. Now, another difference in the MBI is for railroad Medicare. No longer will it be designated by the prefix of an R on the ID number. Instead, you want to take a look at the differences in Medicare cards between railroad new and railroad previously. And in a moment, we'll talk about some of the changes in the cards. So, on the left-hand side, you'll see what the old cards look like. And on the right-hand side of the screen, you'll see the new cards. So some obvious changes. One, there's a difference in design between Medicare old and Medicare new. Here's where you have your HICN, which is again Social Security based, and replacing it is your MBI, which is again a combination of numbers and letters all in uppercase. Gone is the sex of the beneficiary, and gone also is the signature of the beneficiary. Now, if you take a look at railroad Medicare, you see a different logo on top and a very distinguishable footer at the bottom that says this is a railroad Medicare beneficiary. So again, look for the designs of the cards to help you to determine between the old cards and the new ones. So timing. As I said earlier, beginning this year, CMS has been in the process of generating approximately 150 million MBIs. So starting April 1st is the transition from the old HICN to the new MBI. Now this transition takes place starting April 1st of 2018 and will run through December 31st, 2019. During this transition period, CMS or Medicare will accept either the HICN or the MBI on its transactions. So either identifier will be accepted under Medicare. However, starting January 1st, 2020, only the MBI will be accepted. Now, Medicare is sending out the ID cards in 8 waves. So if you're a brand new beneficiary to the Medicare program, you're only going to get an MBI-based card, and those cards were sent out beginning January 1st of this year. So new Medicare beneficiaries should be receiving their new Medicare cards as they enroll. Now, existing Medicare beneficiaries will get their cards in a series of 7 subsequent mailings. If you're in Delaware, DC, Maryland, Pennsylvania, Virginia, or West Virginia, those Medicare beneficiaries should start getting their card sometime in May, followed by the second wave of Alaska, America, Samoa, California, Guam, Hawaii, the Mariana Islands, and Oregon. They will get their cards in May as well. And then starting in June, you have the states of Arkansas, Connecticut, Alabama, Arizona, and Kentucky. Those areas will begin to get their cards in June. So why is this important? It's important because stakeholder systems have to be ready to handle, submit, or exchange the MBIs beginning April 1st, 2018. That's because if you receive any new Medicare beneficiaries, all they will have is an MBI-based new card. So the following guidelines are valid for this transition period. Either the MBI or the HICN can be submitted during the transition period of April 1st, 2018 through December 31st, 2019. If an eligibility transaction is sent with a HICN and the beneficiary has been sent a new card, CMS will send back a message in the eligibility transaction that says, quote, CMS mailed a Medicare card with a new Medicare Beneficiary Identifier, MBI, to this beneficiary. Medicare providers, please get the new MBI from your patient and save it in your systems, end quote. Now, CMS will actively monitor the use of HICNs and MBIs during the transition period to ensure adoption of the MBI only starting on January 1st, 2020. During the transition, the MBI will be returned on the 835 remittance file when available. So another tool that providers can use is coming online in June, and that's a secured lookup tool. So if a beneficiary does not have a new Medicare card at the point of care, providers will be able to access that patient's MBI securely through a new lookup tool under development by CMS, and this new lookup tool or this portal will be managed by the Medicare administrative contractors. So look for this tool coming online sometime in June as an additional resource that providers can use for obtaining MBIs. So what's eRAD's strategy for this transition? Well, eRAD has decided to address the changes in the following ways. First of all, eRAD RIS will accommodate both the HICN and the new 11-character alphanumeric MBI. When eRAD RIS receives a message back from CMS that a new card has been mailed, a patient alert will be triggered, asking the reception staff to collect the new card. This alert will only trigger if the MBI is not in eRAD RIS already. When a beneficiary elects to join a Medicare Advantage plan, the Medicare Advantage ID number should be used to file claims. The Medicare Advantage ID cards still should be collected and the subscriber number from those cards entered into eRAD RIS. Now, in terms of external education and outreach, CMS has been very forthcoming of new information, and there's patient flyers, YouTube videos, and a range of content that's available to help patients manage the transition. And you can just look up cms.gov Medicare new Medicare cards. The link I provided provides a wide range of educational materials that can be used for patients and providers with the new cards. And then we encourage our clients to work with their billing companies and their clearinghouses to be able to submit and receive back the MBI. So with that, concludes the formal part of our presentation. Now I'll turn it over to Brooke for any questions and answers. Brooke?